This lady that's up here right now pretty much needs no introduction for anybody in the world of biologic dentistry, all right? She is Dr. Blanche Grube, and she is a board-certified biological dentist. She's a former president of the International Academy of Biological Dentistry and Medicine. She holds a mastership from the IABDM. And she's also holding a mastership from the International Academy of Oral Medicine and Toxicology, the Institute of Natural Dentistry, and the Dental Association of Conscious Sedation. Dr. Grube owns the Clinic and Centers for Healing in Scranton, Pennsylvania, Biocomp Laboratories, DNA Connections, and the Huggins Applied Healing, all right? She's an international lecturer. All right, and she's committed to training dentists from around the world about biologic dentistry. So please give us a warm welcome for Dr. Blanche Grube.
Thank you, Doug. I'm supposed to read this disclosure. I do have a financial interest in everything. No, of a product, okay, in my talk or with a company offering grant money. That's not true. Nobody's ever given me anything for free. For this continuing dental and medical education program. There we go. She's 4 years old. Isn't she cute? Brooklyn, New York. At the age of 4, I had my first mercury filling. And probably a couple of pulpotomies. Those are partial root canals. And stainless steel crowns. Those are nickel crowns. By the age of 7, I had my first mysterious kidney problem, and I was in and out of hospitals for kidney problems all the way through junior high school. By 3rd grade, I could not read and was placed in remedial reading, from which I never graduated, by the way. I was in remedial reading in high school. I never got into college because I couldn't pass the English 101 placement test. And so the professor said to me, why don't you take the Evelyn Wood reading course for you? I guess I'm one of the old folks now, for you old folks who remember Evelyn Wood. And so I took the Evelyn Wood reading course. I went back and I took in the English placement test again, and I failed it again. And she said, well, why don't you take the Evelyn Wood reading course again? All right, I will. And I took the test again, and I failed it again. And she came up to me and she said, did I hear you say you're a music major? Yeah. And she says, well, you know, this time you only failed it by 1 point, so I'm going to give you that 1 point so you can get in. Just promise me you never leave the music department. I promise. I will never leave the music department. That's why I'm a musician, because I can't read. Okay, so that's how I got into college. I could not read. At the age of 19, I started working as a dental assistant, because I suddenly realized in my senior year of college that I don't want to teach music. These brats don't care that there's 4 beats to the measure. I'm not spending the rest of my life doing this. And my father said, oh, really? Let me see, 96 credits, no bachelor's degree, you're over 18, guess what? You're going to get a job and you're going to give me $20 a week, room and board. Dad, come on. I only have 4 students. That's $20 a week. He said, that's not my problem. I didn't realize how wise and smart my father was. So I got a job as a dental assistant because the only job available with no experience necessary. Got my job as a dental assistant. I started squeezing mercury with my hands. I was already mercury toxic. At the age of 20, the dentist was nice enough to give me a full mouth full of brand new mercury fillings. In less than a year, my thyroid swelled up to the size of a grapefruit, and I had my thyroid gland removed. By the age of 42, I was diagnosed with chronic metablastic leukemia. I had my fillings removed. I met Dr. Hal Huggins in 1992. As a matter of fact, 1992 was my first IAOMT meeting. There were approximately 25 to 30 dentists, and Marcia Basciano was the only other woman, so I clung to her. And I can't believe my eyes now looking out at this audience. This is absolutely incredible. Anyway, so I did meet Hal Huggins. I had all my mercury fillings removed. I had 5 root canal teeth removed. My brain fog disappeared overnight, and all of a sudden now I'm a speed reader. And obviously the leukemia is gone, because I wouldn't be standing here talking to you. The dentist that placed those mercury fillings and baby root canals in that little girl's mouth had no idea how he had changed the course of her life. And it's with God's guidance and a lot of detox that I'm able to stand here in front of you today. So, a little history. 22 million, this is, by the way, this is 2006. We're now up to 30 million. But in 2006, a survey said there were 22 million root canals. Endodontic is root canal. Root canal procedures done annually. Amazing. So, what is a root canal? Because I'm not really 100% sure who I am speaking to here. So how many of you are non-dentists? How many of you are physicians? Okay, this side wins. There are more okay, so I'm going to spend just a few minutes. Okay, you dentists, you can close your eyes and go back to sleep, because the coffee's not that strong here in the hotel. I'm going to go spend just a few minutes explaining to the non-dentists what the heck is a root canal. Okay, so Anatomy 101, we've got the crown portion of the tooth. That's the part that you see when you smile. And then you've got the root portion of the tooth. And it's very interesting that the tooth is the only part of the human body that is ectodermal and mesodermal at the same time. The tooth is the only part of the human body that is outside of the body and inside the body at the same time. And so outside of the enamel, that's the part that everybody sees. That's the part I hopefully you all brushed this morning. Below that is the dentin layer. And inside of that is what I call the Holy of Holies, or the pulp. Most of the time, a person needs a root canal because they have way too much sugar in their diet. Their phosphorus level has dropped below 3.4. And now the fluid flow has reversed itself. Instead of going from the inside of the tooth to the outside of the tooth, it reverses and goes from the outside to the inside, carrying with it all of the bacteria and all of the bacterial toxins into the tooth. You may not all realize it, but right now you're losing fluid through your skin. You're sitting here and you're perspiring. Well, so are your teeth. Your teeth are moving fluid from the inside to the outside. It's one of the ways that God intended for the teeth to stay clean. But when the mineral content drops, when there's too much sugar in the diet, the reverse happens, and now you've got a cavity. Once that cavity is through the enamel and into the dentin, that is when the dentist says, you have a cavity that has to get filled. By the way, that's what we were taught in dental school. We were taught that if you see decay or hypocalcification in the enamel, well, don't worry about it. We'll call that incipient decay. You only fill it when it's in the dentin. And the reason I say that is because it's very significant. Weston Price, back in the 1920s, said that if decay is halfway the distance from the enamel, I'm going to see if I can point this out here. If he said that it's halfway the distance from the enamel to the pulp, which is in the dentin, if the decay is halfway from the enamel to the pulp, then the bacteria are already in the pulp. The tooth is already irreversibly infected. Already. And that's the point at which we were taught in dental school, okay, now we got to fill it. But that pulp is already infected. And it's just a matter of time before it dies. Either the patient dies, the person dies, or the tooth dies. One's going to go first. Halfway the distance. So we already have a problem with the way dentists diagnose decay and decide when are they going to do something about the tooth. I think I just lost volume, or you lowered it? Okay, all right, very good. Okay, so we have a cavity. It's now halfway the distance between the enamel and the pulp. The pulp is now infected, and the patient may actually say they feel a little sensitivity. And maybe the dentist can fill it and maybe the dentist doesn't fill it. But either way, the bacteria are still marching towards the pulp because they like things that are warm and fuzzy and free food and lots of good stuff circulating around. So the bacteria enter into the pulp and then they begin to multiply. And before you know it, this whole area is infected. And the patient may not feel a damn thing. As a matter of fact, the patient may not even know they have a tooth that is non-vital or dead. The bacteria continue eating all of this, and then they metabolize the food that's in here, and they do the same thing we do. They produce toxins, and they produce gases, and those gases go down to the bottom of the tooth here and begin to extrude outside the bottom of the canal. And of course, it's the top of the canal for an upper tooth. And at that point, that pressure puts pressure on, the pressure from the gases puts pressure on the bone, and bone dissolves under pressure. And then the dentist holds up an x-ray and says, "Oh my God, you have an abscess." And the patient may or may not even know they have an abscess. You'll see a slide that I'll show you later on that says 50% of those of us over the age of 50 are walking around with an abscessed, dead tooth, and we don't even know it. 50%. And when you're over 65, the numbers are higher. So now the dentist says you've got an abscess down at the bottom of the tooth. I'm sorry for you people on this side. I can't even see the screen from where I'm standing. But I'll describe where I'm pointing. I'm pointing to the bottom of the tooth. This is where the dentist says, "Ah, yes, you have an abscess. We're going to do a root canal." Or the dentist says, "You need a root canal." It's an important word. You need a root canal. The patient says, "Why do I need a root canal?" Well, because you don't want to lose your tooth. "I don't want to lose my tooth?" No. Well, if the tooth is dead, why would you keep it? So the dentist begins to take some files. Actually, let me go back to this one again. Dentist drills a hole on the top of the tooth, takes some very crude files down the main canal, and tries to clean out all this pulpal tissue in here. All right? What the dentist cannot get to is the millions and millions of little lateral canals that are in this tooth. Cannot do it. So there are what we call accessory canals. There are billions and billions of dentinal tubules that run sideways from the pulp and from the main canal. They say that in a central tooth, a front incisor, if you were to take all the dentinal tubules and run them edge to edge, it would be 3 miles long. That's a lot of dentinal tubules. The dentist cannot clean those out. It breaks all the laws of physics. Cannot do it. So we have necrotic tissue, meaning dead tissue. You have bacteria living inside these accessory canals. And sometimes you can see the bacterial infection as it comes out the side and into the periodontal ligament space. Okay? And so then, after the dentist thinks he has cleaned it out, and let me give you a little aside story. I was in my senior year of dental school doing my root canals. You had to do 4 root canals in your senior semester to pass. And at the end of your filing, you would take a paper point, put it down into the middle of the canal, take that paper point, put it on a Petri dish, stick it in the autoclave, not the autoclave, that would kill it. Stick it in the heater, wherever it was it went, and in 2 weeks you were supposed to look to see if you had a culture. If you had no culture, then the tooth was sterile, and you had permission then from the chief instructor to go ahead and fill that root canal. So Blanche is busy trying to get her root canals completed, and I'm scratching my head because every time I do a culture, it comes back positive. Oh, Lord, the pressure is on. And so I went over to one of the graduate students who was becoming an endodontist and said, "Could you please help me here? I'm doing these 4 root canals, and every time I take a sample, I get a positive culture. I'm never going to graduate at this rate." He puts his arm around me and says, "Blanche, come here." I said, what? He says, you want to graduate, don't you? Yeah, I want to graduate. Okay, so listen to me and listen to me carefully. You're going to take that paper point, put it down into the canal, and take it right out again. Do not let it touch the walls of the canal. He says, and believe me, you will get a negative culture. You can finish up your root canals. Okay, I can do that. Yes. Because when you're in dental school, you don't care what they're teaching you. You just want to pass. You just want to pass. You just want to get out of there. All right? So that's what I did, and I got 4 negative cultures. It was wonderful. But if you touch the inside of the canal, you're going to get a positive culture because all root canals are infected. All root canals are infected. And then after I got my negative culture, I could go ahead and stick a piece of gutta percha, or some people say gutta perca. Gutta percha is a rubbery material. It comes off of a tree in South America, Malaysia, or wherever. It was actually a board question, who knows. That gutta percha is warmed up, placed down into the canal, heated up so that it spreads, and then shoved in there because the dentist is trying to get a tight seal down here. This is the apical or last 3 to 5 millimeters of the tooth. I mean, it really is kind of funny. You know, I've always said, never get beyond 8th grade mentality. That's when you get yourself into trouble. Just think like an 8th grader. You'll pretty much stay safe. How the heck are you going to take something down here? You don't even know where the hole is. It's called the apex. You don't know if is it down here at the bottom? Is it up here? Is it off to the side because the tooth took a curve? Where's the apex? Who knows? I understand now they have high-tech glasses and microscopes and machines that you can actually look and see where the apex is, but they didn't have them in those days. They did not. So the dentist then puts the gutta percha down here, heats it up, like I said, melts the gutta percha, and then what happens? The gutta percha cools off. And when it cools off, it shrinks. And oh, look at this. Now there's lots of room for bacteria. They're having a ball. Silly dentists. You thought you could seal this off? Because here's the truth. This is a picture of a real tooth. Look at the size of that accessory canal. Looks like the Grand Canyon, doesn't it? Look at all the billions and billions of dentinal tubules. It's a sponge, damn it. It's a sponge. You cannot sterilize a sponge and keep it sterile. You cannot. Okay, so that was Root Canals 101 for all of the non-dentists here. So we do have to have a little bit of history. According to a BBC article in 2016, they say that the dental drill appeared before writing, before civilization, before the invention of the wheel. I'm amazed. I didn't think there were that many people with cavities back then. As a matter of fact, amongst the hunters and gatherers, that's what we call now the paleo people. Hey, what are you? Hi, how you doing? What are you? Are you vegan? Are you paleo? Are you just a plain vegetarian? That means you eat Twinkies and pasta, right? What are you? Well, you know, I was keto, and then I decided to go vegan, and I think I'm paleo now. It's a crazy world we live in. Well, the paleo cool people back then only had maybe 5% some cavities. That was it. And those who ate different foods, maybe some fruits and berries, had a few more cavities. Those who settled down, though, and became agriculturists and were eating bread and grains, anywhere from 10 to 85% decay. This is a 14,000-year-old adult male skull found in Italy. Somebody drilled a hole in this tooth and attempted to do a root canal. If that person was part of the aristocrat class, they better have done it with anesthesia because they would have gotten their head cut off. Amazing. This is ancient Egypt. Now this is, don't forget, back then, ancient Egypt thought they were civilized. They were eating white bread. And this poor fellow lost his 2 front teeth, either due to periodontal disease, gum disease, maybe he got hit in the mouth by a camel, who knows? Okay, but look at the fancy jewelry work here. Wow, talk about crown and bridge. Okay? This reminds me of the commercial on TV. They say, what was life like before Surrey? Right? Have you seen that commercial? What was life like before Surrey? And they have the Egyptian banging on the wall. And he says, Surrey, get some more toilet paper. And the other guy yells out, and a chicken. You know? And he's tapping this information onto the wall. So look at this fellow. He's over there tapping, okay, we need something to fill hole in tooth. Okay? But the Egyptians, because of their diet, they had serious gum disease and decay. 1687, we got Charles Allen wrote the first full textbook on dentistry. Pierre Fauchard is actually part of Boston University Dental School, is named the Fauchard Clinic. Pierre Fauchard wrote a book also called The Dental Surgeon, and he dispelled the legend of the toothworm. They believed, before Pierre, they believed that people got decay because there were toothworms that came and ate up the inside of your teeth. And so he dispelled that and said, no such thing. Well, that's really funny because in 2020, we now know the microorganisms that cause periodontal disease and decay very often are like worms. We're looking at parasites. We're looking at spirochetes. So I hate to tell Fauchard, but no, it really is caused by worms. Okay, anybody here can say his first name, I'll buy you a beer. Somebody said it here? Shir Jashub. Shir Jashub Spooner, 1836. He wrote the Treatise on Surgical and Mechanical Dentistry. So here we're beginning to see dentistry shifting to more of a mechanical profession. He recommended arsenic trioxide for pulp devitalization. So how many of you are okay with having just a little bit of arsenic in your mouth every day? I understand that's a good way to knock off your spouse, is to put a little bit of arsenic in their coffee every day. Just a little bit. They won't taste it. Okay, so he was one of the first introducers to arsenic. And then we've got Edwin. Look at the length of that beard. I wouldn't want to be his patient. Must be an itchy event. No kidding. He made the first root canal instrument by using a watch spring. I'm sure that was sterile. All right. Edwin Truman, 1847 we're up to now. He was the one who discovered gutta percha or gutta percha. We can take this rubbery material. It's thermoplastic, which means it'll heat up and move. What he didn't tell everybody was that it also contracts when it cools off. Okay? Frederick, well, at least he just had a mustache. That wasn't too bad. He was the first one to use camphorated chlorophenol. They are still using phenol products today when doing root canals. He used those to sterilize the inside of the root canal. He also invented dental x-rays, so he made some incredible discoveries and good contributions and some bad ones. Okay, the focal infection theory, about 100 years ago, luminaries of the day studied dental and oral sepsis as a cause of disease. And even today, we're still a little fuzzy on which comes first. Is the patient diseased, and that's why they get breakdown of their mouth, and they get decay, and they get periodontal disease and lose teeth? Or is it the opposite? Does the mouth break down first, and then the continual breakdown of the mouth causes systemic disease? Dr. William Hunter, 1900, he said, we have all kinds of diseases in the mouth, not just pyorrhea. That's how long I've been in dentistry. They used to call gum disease pyorrhea. They used to call it Vincent's infection or trench mouth. because the fellows in World War I and World War II fell into the trenches during the war, did not brush their teeth, developed infections, and they named them trench mouth. So even when I was a dental assistant back in, I hate to say what year, 1969, we had patients who came in and said, I have trench mouth. I always wondered why. There's no trenches in New York. And maybe there are. Anyway, he said all of the conditions were septic in nature. They all produced pus. And he also asked the question, is the effect on the person determined by the individual's resistance? Which comes first? Frank Billings, he described it as a focal area of infection with pathogenic organisms that affect then the whole body. Rosenau, he followed Billings. He also concluded that these infections in the mouth may be the source of systemic infections, and they need to be removed. He was one of the first that said root canal procedures should cease. Here comes the father of biological dentistry. We should all be bowing. Dr. Weston Price. He was the founder of the National Dental Association. It later became the research section of the American Dental Association. He published over 150 scientific papers. He had many, many intelligent, superior scientists working under him. People like Victor Vaughan, Charles Mayo, Milton Rosenau. I know the medical people recognize those names. So for dentists today to say, oh, that research was done over 100 years ago and it's not relevant today, they don't know what they're talking about. They literally do not know what they're talking about. He spent 25 years looking at root canals and looking at the effects that root canals had on the patient's body. He authorized 2 books, Dental Infections, Oral and Systemic. You can still get these today through the Weston Price Foundation. Dental Infections and Degenerative Diseases. His work is one of the most important discoveries in the past 100 years related to health and systemic diseases. Take a look at those root canals on the left side. The pink stuff that you see down the middle of the canal is the gutta percha, or gutta percha. On the left side of that root, you'll see what looks like a paper point, and you know what? It probably is a paper clip or some kind of metal that the dentist bent and stuck down the middle of the distal canal, the back fat canal, and then stuck a crown on top of this tooth. Why? Because everybody knows root canals get brittle. Teeth at a root canal get brittled with time. Why? Because there's no circulation. And if the tooth gets brittle, it's going to break. So we have to put a post in the tooth and we have to put a crown in the tooth. So sometimes when the dentist says to the patient, you need a root canal, they're not really telling the patient the whole story. Yes, you need a root canal, and then after that, you're going to need a post, and then you're going to need a crown on top of that. And when that breaks, then you're going to need an extraction, and then you're going to need an implant. Oh, and by the way, there's probably nothing to hold the implant, so you're going to need some kind of graft material put in first. Funny word, need. Price treated extracted teeth with all kinds of medicaments, everything he could possibly find, and found that when the teeth were sectioned, their dentin and cementum were still infected. For the non-dentists here, the cementum is the thin outside layer of the root that is part of what we call the periodontal ligament space that attaches to the bone. He biopsied sections of teeth at and below the gum line and found there was always bacteria there. Always. In the words of Weston Price, root fillings rarely fill pulp canals, and that is still true today. Sufficiently perfectly to shut out bacteria. Impossible. Completely or permanently. Root fillings usually fill the pulp canal much less perfectly due to the contraction of the root filling material. Infection is a relative matter. The quantity and the amount of danger from the infection are both related to the defense of the host. So the infection is going to happen no matter what. How seriously it affects the human body depends on the resistance of the host. So he researched the relationship between root canal teeth and degenerative diseases. And he used thousands of rabbits for his studies. He would never get away with that today. Nor could he afford to do that today. He would take a root canal tooth and implant it into the animal, a rabbit. And whatever disease the patient had, the rabbit developed the same disease. And he started with the root canal tooth of a patient who had had a root canal completed and then within a week died of a heart attack. He took that tooth out of the patient before the patient was buried. He put that tooth in the ear of a rabbit, and the rabbit within 24 hours died of a heart attack. He took the tooth out again, put it in the ear of another rabbit, and the rabbit died of a heart attack. Like a true scientist, he did this 200 times, and 200 rabbits died of a heart attack. And then he continued his studies. He started doing people with rheumatoid arthritis, people with cancer, people with all kinds of ailments. Whatever ailment the patient had, the rabbit developed also. Okay? He found that root canal teeth were always infected, regardless if they were symptomatic, meaning whether the patient felt pain or not. Profound observation by Weston Price, and I'm going to read this because I think it's very important. A considerable number of the members of the dental profession, of which I is one, of today do not want to hear the message that condemns the teeth upon which they desire to make operations. They want to do a crown, they want to do a bridge, they want to do this, and they want to do that. It is necessary for this and for other reasons, including politics and institutions, that will do the most fearless and aggressive dental research, will best accomplish the attainment of new truth. The dentistry of the future must be fundamentally based upon the foundation of pathology rather than mechanical skill and art. No less art and skill will be needed for legitimate restorations, but the operation of choice will not be decided based on mechanical basis. I don't know about you fellas or ladies. When I went to dental school, our very first day, we put on our new jackets, we sat up real tall and straight in the chair, and they said, "Ladies and gentlemen, we are going to make you doctors of the head and neck." And I went, "Yeah, that's me. I'm going to be a doctor of the head and neck." And that lecture was over 15 minutes later, and they proceeded to teach us how to be mechanics of teeth and how to be carpenters. Is that not true for most of us? Okay? Doctors Voll and Kramer, many of you have heard these names before, they were able to show the interrelationship between teeth and body organs using the Chinese meridian systems and energy patterns of the body. So, I've been practicing biological dentistry for 28 years. And in 28 years, I have never had a patient who came through my office with cancer who did not also have a root canal or cavitation. And very often, the root canal and cavitation, 90% of the time, was in the same meridian as where their cancer was. As a matter of fact, Hal Huggins challenged us in 1992. He said, if any of you can find a woman with breast cancer that doesn't have a root canal in her bicuspid or upper first molar or cavitation, I'll give you $1,000. And I'm a gambler. I was like, ooh, baby, you're on. I'm going to find that patient. And I looked and I looked and I looked. And then one day a patient came in with second time around breast cancer. Beautiful woman. No breasts left because she had them both removed, but the cancer came back. And I asked her, I said, so where is your root canal? And she looked at me kind of funny and said, I don't have any root canals. No. Really? Okay, so how many cavitations do you have? A cavitation, by the way, for those of you who don't know, a cavitation is a hole in the jawbone where usually a tooth was extracted, but the socket never healed. I said, so how many cavitations do you have? She says, none. I have all 32 teeth. Lord, I had that money spent 6 ways till Sunday. I was so excited. And I said, wow, this is amazing. This lady's got second time around cancer, and she doesn't have any root canals or cavitations. You know what? Let's go ahead and do the exam. And I'm doing the exam, and all of a sudden I come to tooth number 6 for you non-dentists. That's the upper right canine. I come to tooth number 6, and I said to her, Miss, have you noticed how dark that tooth is compared to all your other teeth? As a matter of fact, it's almost black. Oh, Doc, I forgot to tell you. That tooth was lying sideways over the bicuspid meridian. It was lying sideways up here, and I had it orthodontically and surgically moved down into place. Bingo, there's my dead tooth. She was the only patient that I actually came close to getting $1,000. Yeah, didn't happen. So anybody here ever have a patient? You will not find them. I'll give you $10,000. Show me somebody who's got cancer and has 32 perfect teeth. I will give you $10,000 if I have to beg, borrow, or steal. You will not find that patient. And conventional dentistry says there's no connection. Really? Joseph Issel, this man was a giant. He wrote the synopsis as root canals as a focus of infection and its relationship to cancer. God bless Olympio Pinto, because while I was preparing for these slides, he sent me this email, said, Blanche, you must read Joseph Issel's work. And I was blown away because that was the missing link. It's what I was looking for. Because in Issel's paper, he also mentions a fellow by the name of Bartlestone. And Bartlestone is the one who would put radioactive iodine inside of a root canal tooth and found that radioactive iodine in the thyroid gland 20 hours later, not even a full day. What the heck? Went from here to here in less than 20 hours. And this may come as a shock to you, but I don't think so, because I think I'm preaching to the choir here. There's more to the body than arteries, veins, nerves. We've got energy patterns, we've got ground substance, we've got mesenchymal tissue. There's a lot more to the body than what we were taught in Western medicine. How does it go from here to here that quickly? Okay? Bartlestone also described the thioethers. Now, the first time I had heard thioethers was from Boyd Haley. The thioethers that come out of the root canals is the toxic part. He described dimethyl sulfate as the most toxic thioether to come out of a root canal tooth. And why is it so friggin' dangerous? Well, because number one, it is slightly alkaline. Therefore, it's stored very easily in the mesenchymal tissue, the ground substance, the connective tissue, all the stuff that's not cells. It's fat soluble. Therefore, it enters very easily through cell membranes and destroys the mitochondria. And it binds to important electropositive metal ions. For example, cobalt, iron, copper, magnesium. These are all important cofactors in our metabolism. Dr. Kellner is another one who worked with Dr. Issel. He said the toxins coming out of root canals are genuine tomines, meaning neurotoxins. They're a mixture of endogenous and exogenous microbial proteins which are not detoxified by the body. The body doesn't know what to do with these chemicals, nor are they broken down by inflammatory reactions. These neurotoxins are cumulative within the connective tissue. That's why a patient can have a root canal, walk out of the office and say, I'm fine. And conventional dentistry says, root canals don't make you sick. No, they don't. Not right away. It's kind of like mercury. You don't walk out of the dental office with a brand new mercury filling and drop dead on the steps. No, it takes 20 years for that mercury to build up in your body and cause serious problems that you're now aware of. The same with root canals. The older the root canal is, the more toxins have been released and are being stored in the body. These toxins do one more thing. They change your metabolism from being aerobic, remember the old Krebs cycle? From being aerobic metabolism going into fermentative or non-aerobic metabolism, which then converts your normal cells into cancer cells. Boyd Haley was giving a lecture once on enzyme degradation in the body, chemicals that cause enzyme degradation. And I went up to him after the lecture and I said, Dr. Haley, hi, I'm Blanche Grube from Scranton, Pennsylvania. If I was to send you a root canal tooth, could you tell me if it was toxic? And he said, yeah, sure. He says, yeah, go ahead, send me a tooth. So I sent him 38 teeth. 2 weeks later, Blanche always does everything in a big way. 2 weeks later, he calls me up and he says, hi, this is Dr. Boyd Haley. I said, oh, hi, did you get any results? He goes, yeah, I got some results. You know what? You need to get out of Scranton and now. Huh? Yeah, you need to get out of Scranton. There's something terrible in Scranton because, let me tell you something, those 38 teeth, they were all toxic. He says they were so toxic, we had to dilute them 3 times to get an aliquot safe enough to put in our machine. You got to get out of Scranton. And I said, Boyd, none of those teeth came from Scranton. Most of my, 95% of my practice is out of state. I made sure I picked one from every state. He said, wow. I said, so here's the deal. The reason I did this was because I would like you, because I don't have time. I have a dental practice, 3 kids, 2 cats, a husband, the whole 9 yards. I don't have time. I need you to develop a test. Because at that point, I did not believe that all root canals were toxic. I thought just my root canals were toxic, even though they looked perfect on the x-ray. I didn't believe all root canals were toxic. I said, I'd like you to develop a test so we could tell ahead of time if the tooth is toxic or not. He said, of course I could do that. And he developed something called the Topaz 2 test. And with the Topaz 2 test, we would actually stick a little paper point between the tooth and the gums, absorb some of the fluid, put it in the test tube, bingo, send it to the University of Kentucky, and guess what? They all came back toxic. But at least as a biological dentist, we had something we could hang our hat on and we could say, hey, this tooth is toxic. I have a scientific test here to prove that it's toxic. You need to have this tooth taken out. And University of Kentucky did this test for approximately 10 years. And then Boyd calls me up one day and says, we're not doing the test anymore. What? No, we're not doing the test anymore. You know, Blanche, this is a university. He says, we're always looking for new information. This is not new anymore. It's not new. We're not doing the test anymore. So now Dr. Huggins and I are in a complete panic. What are we going to do? Well, Dr. Huggins was going for his master's degree in immunology, University of Colorado, and so he decided, you know what, let's look at the DNA of root canal teeth. And if we do that, we could have justification for taking the root canal teeth out. And so Dr. Huggins identified 83 anaerobic bacterial species inside of a root canal. And he always said, dentists claim they can sterilize the tooth before forcing gutta-percha down the canal. Perhaps they can sterilize a column of air, just like that graduate student told me in dental school. Sure. Is that really where the problem is? Bacteria wandering out of the dentinal tubules is what Price found and what we were finding in crushed tooth samples. What was interesting was that he discovered that 400% more bacteria were found in the blood surrounding the root canal. 400% more. So the tooth is the incubator. The periodontal ligament space just outside the root supplies more food, and therefore you have a higher concentration of bacteria in that spot. So for those of you who are now removing root canal teeth and sticking an implant in the same day, the same procedure, well, you damn well better make sure you've removed another 2 millimeters of bone where that root canal tooth was resting, because that bone is all infected, and you don't want to put an implant in an infected area. Correct? More findings of Dr. Huggins. Of the 8 bacteria, top bacteria that he found adjacent to the root canal teeth, 5 of them affected the heart, 5 affected the nervous system, 2 affected the kidneys, the liver, and attacks the brain. Provotella intermedia. These are bacteria that we find every day at DNA Connections. We still have dentists from all over the world sending us root canal teeth, sending us samples of the blood from the root canal teeth, and then we can test via DNA and tell them exactly what microorganisms were in that tooth. I'm emphasizing were because it's important. Streptococcus intermedius attacks the heart and lungs, liver, brain. 100% of the samples tested have very virulent microorganisms. I didn't say 99.99%, 100%. Okay? So, conventional dentistry says that root canals are 97% successful. What's their definition of success? The patient walked out of the office and didn't drop dead on the stairs. That's their definition of success. This is the American Endodontic Association. You know, this just came to me just this second. Years ago, I had taken out I hadn't taken out a root canal. I just got a letter from the American Endodontic Society telling me that if I continued telling people they should not have root canals, they were going to see to it that my license was taken away for being an unethical dentist. Can you imagine the balls, the absolute balls? Holy mackerel. I know, you're going to have to edit some of this. I can't help myself. The American Endodontic Association says 25 million endodontic treatments are performed every year safely and effectively. If it were true that root canals cause diseases like cancer, there would be much more information about it. There would be peer-reviewed scientific publications. It wouldn't be the preferred treatment of choice to save teeth. There's no valid scientific evidence linking root canal treated teeth and disease everywhere in the body. Boy, do I have news for them. This is the American Endodontic Society, continually talking, blah, 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 blah. How about you stop talking and do some reading? Because I can read now. Yeah. How about we do some reading? Okay, the only alternative, I love the bottom one. The only alternative to endodontic treatment is extraction of the tooth. Oh my! Extraction is a traumatic procedure. Oh my! And is known to cause a significantly higher incidence of bacteria entering the bloodstream. Well, that is true. If a dentist takes a pair of forceps and starts rocking a root canal tooth, they're introducing a bacteremia into the bloodstream, which is why you damn well better have IV vitamin C on board. Absolutely. That is true. But you know what's more traumatic than Blanche Grube having 5 root canal teeth extracted? What's more traumatic than that would be Blanche Grube dying at the age of 42. And I'm about to get more vulgar, so I'll stop and go on to the next slide. You wouldn't cut off your hand if you broke a finger. Of course not. So why would you extract a natural tooth if it could be saved? Well, let me tell you something. If I had diabetes and I go into the physician's office and I say, hey, doc, take a look at my toe. It's turned black. What do you think that physician's going to say? We're cutting that toe off. Because the physician understands that a necrotic toe is going to spread toxins throughout the rest of the body. How am I doing time-wise? Okay, good. I have I got to tell you this, my favorite story. We had a meeting in Nashville, Tennessee, I think a few years ago, and I went to the Jack Daniel's distillery. And it was a funny story. Jack Daniels walked into his office on a Sunday afternoon, couldn't remember the combination to his safe, so he kicked the safe with his foot, and he broke his toe. The toe turned black, and so they cut his toe off. Then his foot turned black, so they cut his foot off. Then his leg turned black, and they cut his leg off. Poor Jack Daniels. He was sitting on the cure. Old number 7, if he had poured it on his toe to begin with, he would have lived another 20 years. That's one of my favorite stories. Holy mackerel. That's what I learned at that meeting, all about Jack Daniels. Nothing looks, feels, or functions like your natural tooth, and it should be saved whenever possible. Well, that is true. A partial denture doesn't feel like your own teeth. Don't be absurd. Of course it's not going to feel like your own teeth. But I'd rather have a partial denture and be alive than not have a partial denture and be dead. Let's see, where am I? I got to go faster, guys. I'm sorry. Okay, Sargenti root canal. Some of you dentists may remember them. He used paraformaldehyde. Well, the Endodontic Society went crazy. You can't do for Sargenti one-day root canals. They're toxic. Now, this is the American Endodontic Society telling us that the chemicals that Sargenti put inside the teeth come out of the tooth. Oh, really? What about the chemicals they put inside the teeth? They don't come out of the teeth. So they're yelling and screaming about dentists doing Sargenti root canal. You know why? Because general dentists could do a Sargenti root canal in 20 minutes. And they were stealing money from the endodontics. That's why they were up in arms about it. And let me tell you, when that paraformaldehyde comes out, look what happens to the root of the tooth. Woo! The body says, what the heck? And it sets up all the inflammatory cascades, and now you've got a big problem. Okay, I'm going to skip this because I'm running out of time. Okay. Oh, the gutta-percha. People thought gutta-percha was inert. It's not inert. They looked at 14 different brands, and all 14 brands were toxic. Okay. Genotoxicity. That means these resin-based, silicon-based root canal fillers change your genes. And then you wonder why your child is born with some serious problems. Okay? All root canal sealers are toxic. Dentists who are still practicing using two-dimensional x-rays, you need to get out of the dark ages. And if you don't want to spend the money, and it's a lot of money, if you don't want to spend the money, then send your patients to somebody who does have a 3D cone beam x-ray. Because in this picture here, the root canal looks, I could tear it apart, but most people would say it's okay. And then when you look at the picture in 3D, oh my God, look at the size of the abscess. Okay, more from the American Association of Endodontists. The search for an ideal material continues. Why? Because they haven't found it yet. Remember, this is what the inside of the tooth looks like. It's a sponge, damn it, it's a sponge. Okay. I'm going to skip this slide too. I'm sorry. I'm running out of time. Oh, this article, he was saying that dentists should not do root canals. They should be left to the specialists. That's nice. That's nice. Okay, by the age of 50, 1 in 2 patients, 1 in 2 people, anybody over 50 here? 1 in 2 of you, 50% of you have a dead tooth. By the age of 60, 62% of you have a dead tooth. Dr. Tom Levy gave an excellent lecture about a year ago where he showed how many people are walking around with dead teeth. They don't even know it because it only shows up on a 3D cone beam x-ray. All right? So this is supposedly a healthy root canal. I could sit here for another hour and tell you what's wrong with this root canal. Okay, Lechner. Lechner did some beautiful work looking at the inflammatory cascades caused by root canals, and his conclusion was local pathologies caused by endodontically treated teeth may actually increase immunological and systemic dysfunction. So he's one of the first to say the infection in the tooth comes first, and then it affects the rest of the body. Okay. Some disease. I'm going to have to skip this. Sorry, guys. Okay, this slide, they're talking about coronary heart disease and the bacteria that cause heart problems, all coming from chronic apical periodontitis, meaning you've got an abscess and you don't even know it. These are the bacteria that we look at DNA connections. I love the Helsinki study. They looked at 68,000 patients. They looked at 9 types of cancers that these 68,000 patients had. Root canals were in 70%. Now there's some people who say, you know, just because you see a relationship doesn't mean it's cause and effect. I don't know. I don't know about that. Maybe they said that about cigarettes at one time. Really? Okay. Holzman. The overall prevalence of post-endodontic apical lesions, meaning the tooth is still abscessed even after the root canal is done, is much higher than what conventional dentistry is telling us. Okay, DNA connections, we look at teeth, implants, cavitations, blood tissue, paper points, you name it. And for those of you who think, I will just put in the graft material and everything will be fine, this is a sample that was, Hal Huggins had asked me to get the most expensive, the most sterile cadaver bone I could find, and I did that for him. And I sent it in, but my secretary sent it a day late. So he didn't get to do the study. They put it in the refrigerator at minus 70 degrees. This is deep 7. And a few weeks later, when they took it out, it was growing whiskers. This is sterile cadaver bone. It had 56 microorganisms. These are not good guys either, all right? 66. That's what the test looks like. Okay? And now here comes the problem. When the dentist gets this report and they see all of the red bars, they freak out. More than not, the patient freaks out and nobody knows what to do. This is where you physicians, you naturopaths, you chiropractors have to come into play. Because we're dentists. We're carpenters of the teeth still. We're busy fixing teeth. We need you to look at these microorganisms, do your EAV testing, do your homeopathy, do your drugs if you need to. It's your job to get the patient better. That's what it looks like. And it takes a village to get these people better. It really does. It cannot be done overnight. I hope some of you noticed the subliminal messages that I had put throughout this lecture. If you call yourself holistic, then you are concerned with the whole body, how your dentistry will affect the whole body. If you call yourself biological, then you are concerned with the materials you implant and how they affect the biology of the body. So, after all the material I've shown you this morning, and this is only a portion of the science out there, it is my belief that if you offer your patients a root canal and call yourself holistic, biological, then you must ask yourself if you are within your own integrity. I am totally honored by giving you this lecture. Thank you.